So, hello students, welcome once again to my YouTube channel. And today's topic of the discussion is one of the very important topics, what has been very frequently asked, whether it be the professional exams in pedia or even in human anatomy. So the topic of today's discussion is I'll be taking up the development of face, and in this video I have tried my level best to simplify as to how the development of face has taken place in the most simplest form. So students, when it comes to write in the professional exams or in any of the professional exams, when you're asked about the development of face, first of all what you need to do is you should have a thorough clear idea in your brain that what and how are you going to proceed. So here what comes into important is that the drawing of the diagrams. So just if you have a very clear picture in your mind about the different diagrams, and then you can very easily pen down in sequence as to how the various developmental processes are going to take place. So starting with, so today I'll be mainly focused on the development of face, the development of nose, and how the lips are formed in the intrauterine life. So students, beginning with, so what is going to happen is that during the intraembryonic period, that is in the development of the fetus, once the stage of the fetus is reached, there are on the ventral side, firstly there has to occur the formation of the head fold. So initially, once the formation of the head fold has taken place, what is going to happen is, after the formation of the head fold in the developing embryo, on the ventral side there are two prominent swellings. There are two prominent swellings on the ventral aspect of the developing fetus, and the two prominent swellings which are going to appear on the ventral surface, they are the developing forebrain. One is depicting, one it is the developing forebrain is formed, and the next swelling, it is the pericardium. So these are the two prominent swellings, and they are separated in middle by the stomodium. So it is the stomodium, these two prominent swellings, they are separated in the middle by the stomodium, and just beneath the stomodium there is going to lie the buccopharyngeal membrane. So this buccopharyngeal membrane is present, and so these are the two prominent swellings after the head fold has formed. Now on the ventral aspect this is all occurring. Now on the ventral aspect, since these two folds are there, slowly and gradually what happens is that the mesoderm, which lies the developing forebrain, so this is the mesoderm of the developing forebrain. So this dotted structure what I have drawn, it is the mesoderm of the developing forebrain. So this is going to proliferate more rapidly, and it is going to come and overlap the stomodium. So since this is the stomodium, so this developing forebrain, here it is the forebrain. So the mesoderm, what is going to overlie this developing forebrain, it is going to proliferate more rapidly. It will proliferate more rapidly, and it is going to come and overlap the developing stomodium, giving rise to a most important process which is called as the frontonasal process. So this is the frontonasal process, which is formed by the proliferation of the mesoderm or the mesenchyme, which is overlying the developing forebrain. Now these two images, these two diagrams what I have drawn, they are indicating the lateral view, the lateral profile of the developing fetus. So once the fetus is being observed in this lateral manner. So above it is the developing forebrain, below it is the pericardium, and in between there lies the stomodium. Now this developing forebrain, the anterior region of the developing forebrain, the mesenchyme is going to proliferate more rapidly, and it is going to come and overlap the stomodium, giving rise to the frontonasal process. So I hope this much is clear. Now, moving on from these to the lateral view, from the lateral view, I'll be now once these are the pictures for the lateral view. Now, the next picture, the next image what I have drawn, it is from the front. So from the front view, from the frontal view, so what we'll be having a look at is the frontonasal process. So this frontonasal process, and this is the another prominent swelling, which is the pericardium. So this we are observing in the frontal view, on the front, from the front view. So this frontonasal process, this has proliferated and it has started overlapping the stomodium. Now, since it is the period of the fetus, so the mandibular arch is going to form the lateral wall of the stomodium. Students, do remember that the stomodium, what was visible over here, the lateral wall of the stomodium, it is formed by the mandibular arch. So mandibular arch, it is the first arch. So these mandibular arches, they are going to form the lateral wall of the stomodium. Slowly and gradually, what is going to happen is this mandibular arch is going to give rise to a bud in the superior surface. On the upper end, this mandibular arch is going to give off a bud which is going to it is going to give off a bud that is going to ultimately come and fuse in the midline. So this bud, what is formed on the superior region, on the superior surface, it is called as the maxillary process. So the mandibular arch, it is going to give off a bud on the dorsal surface. So this is the dorsal surface or the head surface. So this budding of what is being given by the mandibular arch from the dorsal surface, it is going to give rise to a process what is called as the maxillary process. Now, these maxillary process, they will ultimately, in the course of development, they will ultimately come and fuse in the midline to form the palate. Initially, the primitive palate will be formed and later on the secondary palate will be formed. So these are the two maxillary process from the mandibular arch. Now, the ventral or the another process, another bud will be given off from the mandibular arch, which is called as the mandibular process, and this mandibular process is formed on the ventral and the medial surface. On the and it is going to proliferate medially. It is formed on the ventral surface and it is going to proliferate medially, giving rise to another process which is called as the mandibular process. Now, ultimately, either it be the maxillary process or the mandibular process, they are going to come and fuse in the midline, forming the lower jaw. Now, this was all about the development of the upper jaw and the lower jaw. Now, moving on as to how the nasal pits, the external nostrils or the nares are formed. So what is seen is, once this frontonasal process, it has proliferated, the mesenchyme, it has proliferated to overlap the stomodium, there occurs two bilateral localized thickenings of the ectoderm. It is going to form on the frontonasal process, and these bilateral localized thickenings, they are called as the nasal placodes. So these are known by the name of the nasal placodes. So these nasal placodes on the frontonasal process, these are ectodermal thickenings. These are ectodermal thickenings on the frontonasal process, and ultimately these nasal placodes are going to form the external nares or the nostrils. Now, on the lateral sides of these nasal placodes, there are another ectodermal thickenings which are called as the lens placode, which are in future they will give rise to the future eyes. So the nasal placodes in future, they are going to form the nose, whereas the lens placodes, they are going to form the eyes. Now, these nasal placodes, what is going to happen, how the development of nose is going to commence. So these nasal placodes, firstly they will sink within the frontonasal process. This was the frontonasal process once the nasal placoids have been formed. So these nasal placoids, they are going to sink or pit. They are going to form a pit in the frontonasal process, and this pitting or the sinking of the nasal placoids, they are going to give rise. They are known by a name known as the nasal pits. So initially the nasal placoids are there, they are going to sink down in the frontonasal process, and after sinking down of these this nasal placoids, the nasal pits will be formed. Now, since the nasal pits, they have been formed, since these nasal pits, they have been formed, so the median and the lateral processes. So once a pit has been, suppose this is a pit what has been formed, so what happens is the margins, the lateral margins, it is little bit everted. Both the nasal pits what have been formed, the margins of these pits are little bit raised or everted. So these margins are somewhat little bit, they are raised or everted, and these everted margins, they are ultimately going to form the median nasal process and the lateral nasal process. So this, the dotted structure what I have drawn, these dotted thing what I have drawn, it is the eversion from the nasal pits. The margins of the nasal pits are little bit raised or everted, and they are going to give rise to the, if it is present on the medial side, it is going to form the median nasal process, and if it is on the lateral side, they are going to form the lateral nasal process. So this was the pit actually, and on the medial side, the eversion, the elevation what is there, it is known as the median nasal process, and on the lateral side, the everted structure what is formed, it is the lateral nasal process. Now, since there are two nasal pits, so there in this midline, they are going there will be presence of the two median nasal process, and on the lateral sides there are the one lateral nasal process, and on the other side there is the another lateral nasal process. Now, during the course of development of the embryo, what is going to happen is slowly and gradually the maxillary process, they are going to come and fuse in the midline. Slowly and gradually the maxillary processes will come and approximate each other, and as well as the median nasal process and the lateral nasal process, they are also going to come and approximate with each other. All right. So slowly and gradually the maxillary process, they are coming approximating each other, as well as the median nasal processes and the lateral nasal processes, they are also coming and approximating each other. They are also coming and fusing with each other. Now, since this maxillary process is going to come and fuse with each other along with the median nasal process and the lateral nasal process, so this is ultimately going to cut off. So this was the stomodium. So this is the fusion of the maxillary process with the median nasal process and the lateral nasal process is going to cut off the oral cavity from the nostrils or the external nares. So once these median and the lateral nasal processes, they have been formed, the nasal pits will now be referred to as the external nares. So these external nares, what we find is, so supposing this was the lateral nasal process, in the midline there were the two median nasal processes, and once the maxillary process, they have come and fused with the median and the lateral nasal processes, that is ultimately going to cut off the oral cavity from the nasal cavity. All right, and now the nasal pits, they will be called by the name of external nares. And also the median nasal processes and the lateral nasal processes, they are also going to come and fuse with each other. So there are two things happening. Firstly, the maxillary process is going to come and fuse with the median and the lateral nasal processes, and the second thing, the median nasal processes of both the sides and the lateral nasal processes, they are also going to come and fuse. So giving rise to the external nares. Now, this kind of a development is occurring. So what is happening is, similar side by side there is a further forward development. So the thinning or the frontonasal process, how these external nares are being so close to each other. So these external nares, they are being so close to each other. Ultimately, in the future, when the nose has been formed, we find this that initially the nasal pits, they were somewhat more laterally. Slowly and gradually, these nasal pits, they come and approximate, and they are somewhat approximated very close to each other. So how this is occurring? So the frontonasal process, it is going to be the frontonasal process. It also narrows down. So what is happening is, the frontonasal process, initially what it was overlapping the stomodium, this frontonasal process, if it was like this, so slowly and gradually, since the nasal pits, they have been formed on the lateral sides, slowly and gradually the frontonasal process, it also narrows down. So this prominence, what you are seeing is, slowly and gradually, since these are also going to narrow down, thereby bringing the external nares close to each other, leading to the formation of the external nostrils. So this is how the nostrils, the development of the nostrils has taken place. Now, moving on to the lower lip and the lower jaw. As I've already said, the mandibular arch, it is forming the lateral wall of the stomodium. On the dorsal surface, it is going to form the maxillary process. On the ventral and the medial surface, medial part, it is going to form the mandibular process. So these mandibular process, they are going to come and approximate with each other. So these mandibular processes, they are approximating each other, and ultimately this leads to the formation of the lower jaw. Now, this lower jaw has been formed, and similarly, slowly and gradually, as the proliferation is occurring, the soft tissue is being formed. So actually it is the mandibular process from which the lower jaw and the lower lip has been formed. And how, what about the upper lip and the upper jaw? So it is the lateral nasal process. Do remember, students, it is the lateral nasal processes. Hi. It is the lateral nasal processes and the fusion with the maxillary process. It is going to form the lateral part of the upper lip. So the lateral part of the upper lip, it is formed by the fusion of the maxillary process and the lateral nasal processes. Whereas, what about the tip of the lip or the philtrum? So this tip of the lip, upper lip or the philtrum, it is formed by the, since it is narrowing, the frontonasal process is narrowing down, the tip or the tip of the lip or the philtrum, it is formed by the, from the frontonasal process as well as by the fusion of the median nasal processes. So students, this was all about as to how the development of face is taking place, the nose has taken place. So in short, I have summarized as to how this development of face, nose and lips is occurring. And one thing in short, if I'm going to summarize, is the frontonasal process, it is going to form the forehead. It forms the forehead and the bridge of the nose. It is formed by the frontonasal process. The maxillary process is going to form the upper lip and the cheek, whereas the mandibular process, it forms the lower lip and the lower jaw. So students, these are the nasal placodes which are going to form the external nares of the nostrils, and these are the lens placodes which are going to form the future eye. So students, this was a very short discussion about the development of the face, the nose and the lips. If you do have any queries or comments, you're most welcome to comment me in the comment section. And students who are visiting my channel for the first time and they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.